So pleased that Jonathan is here with us. He will tell a little bit about himself. You saw the bio that I sent. I think it's important for you to know that he too is a parent of a student. He's a child of three wonderful independent schools that aren't cheap, but he certainly is living the experience. And be present, embrace, listen, and learn. Thank you so much for joining us.
So thank you for that introduction. I'm a licensed psychologist. I specialize in working with kids and teens with anxiety disorders, especially with school-related anxiety. Half the kids I work with are not even attending school when they first walk in my office or log on these days. We're still mostly Zoom. I love my talks to be conversational. I do not pretend to have a monopoly of knowledge or information, especially in this crowd, of how to help kids and teens who are dealing with anxiety. But it is really important that we have this discussion. So Matt was right, that there is a level of suffering that will take your breath away when we go through the data that's there. And it's important that we understand what these kids are exposed to right now, what they're going through. But most of what I want to do is to give you guys practical skills that you can begin using as educators and as parents immediately to really build resilience and to really create a lifeboat for these kids during the storm that we're all in right now. So I'll go through all of those things. But again, the kids aren't the only ones going through this. We are all experiencing the same thing. And I talk to many, many schools, I talk to student bodies, and I'm hearing from many teachers that this year, in many regards, is even harder than last year. Because the kids are, but I'm hearing across the board, and I was in Cincinnati, it's the same way out there, that the kids are really about 18 months behind developmentally where they were, where the social maturity, the emotional maturity, the academic skills, study skills, it's just a very, very stressful time to be a teacher. I was talking to Fairfax County yesterday, and 25 teachers have already left this calendar year, since September 1st. So I know it's very stressful. So just know that the skills that we're going over today to help the kids also work for adults. And so that's the secret behind this, is that when I invite parents in so they can observe what we're doing, part of what I'm doing is giving them the same skills, and parents will often say, "Oh, I could use this too." And I think, who knew? So make sure that you're seeing this through the lens of how to help the students or your own kids, and also how to help and take good care of yourself. Because thank you from a parent of three for everything you're doing. It has created such an amazing experience for kids to get through this time. And thank you after having a long day of teaching to then come and sit and hear me talk for an hour and 20 minutes or whatever it's going to be. So thank you for that. So I love my job. I love it for many, many reasons, but here's one of them. I'm only half joking when I say that if you have a kid who is smart, who's creative, who's compassionate, the universe will go ahead and throw anxiety in for free. It really is this package deal. And so rather than seeing anxiety as a flaw or a weakness, we want to see it accurately as a shadow cast by these virtues. Every virtue casts a shadow, and that's what these cast. And the great news is that anxiety is very treatable, and these great virtues remain fully intact afterwards. I believe that kids, and this is true of adults for that matter, who have an anxiety disorder, who get treated for it effectively, they're better off for having had it and being treated for it than never having it at all, because they've learned really irreplaceable skills, like how to overrule fear as a decision-making tool, or how to pursue your values rather than to pursue what's comfortable. These are life skills, and kids really wouldn't have learned these any other way. And so that's one of the great joys of my job, is watching a kid do something that they didn't think they could do even an hour ago. And now they can do those things. And that changes not only their perception of what they can do right now, but what they can do in the future. And so as we're talking about this anxiety, it's really important that we see these kids as extra alive. They have superpowers. But what they need is the owner's manual for their nervous system. And that's what we want to give them, so they can have an informed perspective of what they're experiencing, to know what it means, but frankly, more importantly, know what it doesn't mean when they're experiencing these things. Okay? Another reason why I love my job so much is I learn at least as much from the kids that they learned from me. And this was the first sentence of one of my former patients' college app essay. And he missed 3 years of high school. And you can't read it from where you are. He said that having an anxiety disorder is like being stuck in that moment when you've leaned too far back in your chair, but have not yet fallen. And I think that captures the phenomenology, the experience of what it's like to be living that way. And by the way, this student who missed 3 years of high school is graduating from a top 10 university in May. Now, that's not better than any other university. I'm not saying that's good, but it was his dream. And so even the kids who were dealing with really pronounced impairing levels of anxiety can and are treated effectively on a regular basis. On a related story, maybe 15 years ago or so, I was talking to a 12-year-old boy, and he walked in my office with a diagnosis of depression already. And so I asked him what it was like for him, because we know it presents differently for different people, and he thought about it for literally 3 or 4 seconds and gave me the best definition I've still ever heard. And he said that having depression makes his life feel like a stick of chewing gum that lost its flavor. And I think, again, that captures the experience, because we know that the opposite of depression is not happiness, it's vitality. And so I'm saying these things because we're going to be going through some scary information about how common these problems are among kids. And we're not just talking about kids and teens, we're talking about students. And so I want to talk about just how much these experiences of mental health challenges, especially anxiety, can compete with and interfere with the learning process when kids are here, and why they're not going to be fully present when you're trying to educate them. Okay, so let's talk about anxiety versus anxiety disorders. And by the way, most of this talk will not be about anxiety disorders, and I'll explain in a minute why. It's more about how do we help kids when there are real stressors in the world and in the environment that are really challenging. So how do we build resilience? But it's really important that we also talk about anxiety disorders so that we can all have the same common language and see the differential between the two. So one of my pet peeves is when I get a call from a new parent looking for services, and they'll say, okay, well, my child has anxiety. And I'll say, well, thank goodness for that, because that's a really important thing to have. Evolution prioritizes the experience of anxiety. It is primal and ancient and effective in keeping us safe. Our spider sense tingles, and it tells us to not do something or to stop doing something, which is, by the way, the same function pain serves, which is to prevent damage to our bodies. And what's really interesting is that chronic pain and anxiety disorders respond to basically the same treatment, just aimed at different structures, but they have a lot in common. So think of anxiety as an alarm that's working, that it goes off in the presence of danger and does not go off in its absence. It keeps us safe, and if we're ever in a situation where we get really, really anxious, scared, or sick, we only need one time to compare those two experiences to never want to be in that situation again. And if you ever had food poisoning after eating something you used to enjoy eating, you'll understand how powerful that combining can be, right? For a lot of us, it involves tequila. I don't know why. And so it's a really important experience that when kids are experiencing a high level of anxiety, their instincts, evolution is going to tell them to avoid that situation again. I have working with a girl, I just met her last week, and she had a panic attack playing a sport and had been carried off the field. And that was 7 weeks ago, and she hasn't been to school since. And so that's not an uncommon story at all. It's just that she's doing exactly what evolution wants her to do at exactly the wrong time. Right? The fear is real, but the danger is not. And that is what creates an anxiety disorder. A disorder that's not marked by the intensity of the anxiety, because we should all feel very anxious in certain dangerous situations, because it orients us to problem solving, to fighting, to fleeing, to freezing, whatever we're going to be doing is an important thing. What makes an anxiety disorder a disorder is simply it's a false alarm. That we feel scared in the absence of danger. We're misperceiving or misjudging the threat cues. Now, if in the morning you're getting dressed and you put a bagel in the toaster and you go upstairs, finish getting dressed, and the smoke alarm in your kitchen goes off, you can never tell by the sound of the alarm whether you burnt your bagels or the kitchen curtains are on fire. The same is true for our fear system. We can never judge by what we're experiencing how accurate our perception of danger is. Right? It's either on or it's off. It's bimodal. It's binary. And so what do? Exactly what evolution wants us to do is that we still avoid. Now, avoidance is a really good thing if there's a snake that rattles. Right? It's a really good thing if someone's coughing unmasked. Right? Really good avoidance strategies. But if we avoid that which is scary but not dangerous, we are firing the best teacher we will ever have, which is our own experience. That would have informed us, would have given us corrective feedback that while the fear was real, the danger never was. And so you see that bottom right, the unnecessary avoidance. Avoidance is the foundation, it's the lifeblood of all anxiety disorders. To such an extent that no anxiety disorder, and that's an absolute statement, can persist in the absence of avoidant coping. And so I always joke that, yeah, I direct an anxiety treatment center, but I don't treat anxiety. I don't have to. Anxiety is two things. It's temporary and it's harmless. What I treat is avoidance that can ruin lives. And so really I run an avoidance treatment center. And the great news is that if we can treat the avoidance effectively, the anxiety will die a natural death. It's like cutting off the oxygen to a fire. We don't touch the flames, but they extinguish anyway. And that's what we do in our work, is that we seek out and eliminate, or at least dramatically reduce, the avoidance of scary but not dangerous things. And this is what we've been doing in our field for decades now, but then we had to switch, because the world got a whole lot more dangerous. We're talking about how we've adapted to that. But let me go through some of the scary stuff. And I promise you the good news, I'll give you the good news first, because a lot of scary stuff. Even in the presence of all the suffering that you're about to see in the data, treatment works. It works wonderfully well for the vast majority of kids, but it is tragically underutilized. And for the counselors here, 75% of all child mental health care in this country is delivered in a school setting. 75%. All right, so let's talk about anxiety for a minute and why I care so much about working with these kids. So there are three things I want you to know about anxiety disorders. Number one is that they are the most common category of mental disorders. Number two, they have the earliest age of onset. So during your lifetime, if you are going to have an anxiety disorder, half will have it prior to their 11th birthday. So it has a very early age of onset. It affects many, many people. The third thing that makes it stands out is it is by far the most treatable category of mental health disorders. So I'm very selfish in choosing the specialty because the kids honestly get better. You know, it's not one of those persistent, like, oh, we're never making any progress. It's like, great, you weren't going to school, now you're going to school. Like, it really works. Now, again, this is pre-COVID, so I want you guys to understand the water these kids were swimming in before this hurricane of COVID hit them. And so we know that about 8% in 2019, on any given day, of those teens are going to have an anxiety disorder. But almost a third will, at some point during those years, between 13 and 18. And the news is worse for the girls, like a lot of things, than it is for the boys. But almost 30%. Now, we're going to see that about 8% have a severe anxiety disorder. These are the kids I love working with who are dramatically impacted on literally a daily basis because of that. Less than 1 in 5 of these kids get treatment. And that's compared to ADHD at 79% of those kids get care. So they're flipped, which makes sense because the anxious kids by design are trying to blend into the background. They're chameleons who are trying to not draw attention or to manage an image, which is a thing I see among teens all the time, and it's exhausting to try and mask what they're really experiencing all of the time, to try and present to the world or to the gram or to whatever that they've done everything together. Okay. All right. I mentioned the girls have it worse. It's 38% of all girls, this is pre-COVID, will have an anxiety disorder before they turn 18. That's almost 4 out of every 10. So do the math for the kids that you work with, for the girls. Whether they're young kids or they're teenagers, 4 out of 10 are going to have an anxiety disorder before they turn 18. And that's literally 10 times what it is for eating disorder, which are real and serious and life-threatening, and deserve all the attention they get. And they're impacting boys more than they used to. But 10 times as prevalent. And this was in 2019. As an example of just how divergent this is from the way that it used to be, that the average teen in 2019 was between 5 and 8 times more likely to show symptoms of an anxiety disorder compared to the same age kids during World War II and the Great Depression. Okay? We were living in the age of anxiety, and we know that the average teen was more stressed than their parents 7 years ago. But that's never happened before. And the numbers keep getting worse in college. It doesn't just stop. Even before COVID, 40 million American adults on any given day have an anxiety disorder. And so we are seeing immense suffering that happens early and often due to these things that we call anxiety disorders. Now, let's look at the 10 years leading up to COVID. You can read these, but oh my goodness. So during the teenage years, in those 10 years, it increased to 37% of these teens are reporting hopelessness and persistent suicide. 16% have made a suicide plan. This was before COVID. Almost 10% are attempting suicide during their teenage years. We are in a crisis. It's really important that we understand this does not evenly distribute among the population, that there are people who are at much higher risk, especially LGBTQIA students. And we know that using, I'm sure I'm not preaching to the choir here at Key School, but using preferred pronouns and preferred names can decrease suicide attempts between sorry about that. But using preferred pronouns and preferred names can decrease suicide attempts among this population from between 60 and 70% by using words. Words matter. And in my opinion, it is malpractice to not use them when we know we can save lives. Okay, so this came out in March of last year. In a calendar year, 12 months, there was a 334% increase in intentional self-injury among teens during a 12-month time period. It's unconscionable. There was more than a doubling in overdoses during that time. People were trying to cope with this stress. There, I don't know if you can see it from the lighting or not, but there's a 94% increase in what's called generalized anxiety disorder, which is a worry-based disorder. That's the one where you worry about a lot of things all the time, feet up on edge, can't relax. Probably sounds familiar to a lot of you this year. A 90% increase in adjustment disorders that can include anxiety and depression and conduct disturbances, and an 83% increase in major depressive disorder in a calendar year. Okay? And what we're seeing with this is how much that's flying in the face. To get this, they were looking at medical reimbursement claims, basically, de-identified medical claims. And look at the spike in mental health claims and how much that was flying in the face of what was happening broadly with all medical claims. Because no one wanted to go to a physician or anybody, nurse practitioner, everyone wanted to avoid medical things in general, and yet mental health was skyrocketing in this population. Not only was it increasing in spite of the overall trend of much lower use of utilization for health in general. This came out in August. It was a meta-analysis. Those of you who don't teach science, what that means is a study of studies. And they were looking at global rates for adolescents. And there's a few things here that are really startling. So they identified this as youth. So it was not just teenagers, so it included people of different age ranges. And you can read it here. They found that globally speaking, that 1 out of every 4 youth has clinically relevant symptoms of depression, and 1 in 5 have it for anxiety. I can tell you, in this country, it's higher because what they also found is they looked at the rates in those communities before and then during the pandemic, and they found a literal doubling wherever they looked of adolescent depression and anxiety. And so we were just talking about these crazy high numbers from 2 years ago. And now we know they've literally doubled in a calendar year. Okay? And to make that even more startling, the researchers were looking at, well, what are the predictors in these different studies that show us like which kids are doing worse? Well, one of the best predictors they found was how far along in the pandemic were the researchers when they collected their data. And the further along they were, the worse the results were. So rather than what we would hope to see, which is, wow, this was like this incredibly hard hit, but then we kind of got used to it, we're doing better now, think of it more like a weight that gets harder and harder to hold the longer you hold it. And so the kids aren't okay. They are doing worse. Now the good news in this, which is only relative, is that the younger kids are actually more protected. And so the data that we're looking at for that is mostly parent reports, which is suspect. We know that for anxiety and depression, it's better to hear from the kids than the parents. It's better to hear from the parents for like behavioral problems. But what the reports were in America was that about 20% of the kids who were in school age range, so like pre-puberty, had their emotional health negatively impacted in a significant way, which is still horrible. But what we're seeing here is that those kids are still primarily looking at their family of origin, their parents, their siblings for that shared experience. And so it's the teens and the young adults that emotionally have been hit by far the hardest throughout this entire process. What questions or comments does anybody have so far?
My question is, what's the difference between anxiety and an anxiety disorder?
The difference is really about, is it impairing your daily function? And is the anxiety, does it make sense? So for instance, I have a girl I'm working with whose father's had an organ transplant. And so he's on very strong immunosuppressive medication right now. And he's at a very high risk for COVID and really bad consequences. He had his fourth dose like 4 months ago. But we don't know how much he's actually going to be able to fight off if he gets it. And she's in school full time at an independent school in the area. And she is very, very anxious about bringing home COVID and giving it to her dad because she might kill her dad. And that's an impairing anxiety, but it's not disorder. I'm thinking about it more akin to the students that we work with who have severe allergic reactions, anaphylaxis. And they're really afraid of having anaphylaxis. And that makes sense because you could if you eat something and you don't know what it is, so it keeps you vigilant and it's protective in that way, it's functional. But even those kinds of fears can start to be disordered if they exceed what the threat is in the environment. So tornadoes are dangerous, we know that. I've had kids who will lay in their bathtubs on cloudy days because they're afraid of tornadoes. So even though that fear is reasonable that there was one coming, we certainly would want to duck and cover, but anything can rise to a level of disorder, even if the fear is a reality-based fear.
The statistics that you showed a couple slides back with the graph with some claims and early medical claims, do you know if that data was parsed out to show minorities or people of low income?
That's a great question. It was not. And so that speaks to the inequity of the way this is affecting people. And so I heard someone say like this a lot, that we're not all in the same boat, we're all in the same ocean, but some of us are driving yachts, some of us are on rowboats. And so what we know to be true in this is that, so there was a term coined maybe 12 months ago called COVID stress syndrome. And they looked at, they're looking at adults, they found 16 kind of adults that meet criteria for this new kind of cluster, which is fear of contagion, xenophobia loaded onto it. So if you were somebody who was of Asian descent in particular, that was an increased risk for it. But what was really interesting is that when they were looking at that and looking at the need for mental health services, what they found was that vulnerability, so like age, underlying health condition, those kinds of things, were actually not very predictive of that level of anxiety. What was previous levels of anxiety. And so we know that people who have that deep empathy, which combines with anxiety, the flip side of the same coin, and are very aware of the world and the future, they were the ones who were more vulnerable than people who were actually more physically at risk because of it. But it's really important that when we're talking about this, that we're not just talking about the illness factor of this, the loss of job, the economic insecurity, I have a guy who's unemployed and his benefits ran out because the government stopped paying for those, and he has autism and he really has a hard time getting a job right now. And so it's really important, thank you for that question, to contextualize the inequitable distribution of suffering that we're seeing. And overlaying all of this is the social justice reckoning that we've seen beginning really with George Floyd, was it 15 months ago or so now. And if we look at that, people of color and indigenous people are really dealing with this collective trauma that comes from that on top of COVID. So this isn't a singular thing happening in a vacuum. It's really the intersection of many, many forces. One of the questions I get asked for years is, do you get a lot of calls after some big national emergency, after 9/11, for instance, or the anthrax attacks, or the snipers? And the answer historically was no. Weirdly, we don't. Because our really anxious people are so focused on just maintaining their own self-regulation that they don't really pay attention to a lot of that other larger stuff. But there have been two exceptions to that. One was 2016 when Trump won. My phone was ringing off the hook with kids, especially the LGBTQIA kids and the girls, who were saying, is sexual assault now licensed, basically? Is it endorsed because of this? So after that, we got a huge influx, and then COVID, us and everybody else. As an example, there's 10 of us in my practice, all psychologists. Usually we get through our waiting list by the end of August, because people regularly call us. The summer we do a lot of school-based anxiety, and we're good to go. We kind of pivot for the new year, welcome everybody back in, and then we're off and running for the school year. This year, the last day of August, we had 263 families on our waiting list. And it's not just us. The mental health system in this country is stressed beyond all measure. There is not the available care that these kids need. There just isn't. I don't know what we can do about it, But I'll tell you what did come out. This is kind of hot off the presses. I was in Cincinnati giving a talk, and this came out. I had to edit my talk in the hotel room before my presentation. That just a couple of weeks ago, these three wonderful organizations together declared a children's mental health emergency in this country. And they had very specific requests for increased funding, extra supports put in place, all kinds of things. So feel free to go and read their statement, because they're talking about, and they're referencing other things, like there's a 50% increase in adolescent girls in ERs with attempted suicide in the last year. 50% increase in the calendar year. And even hospitals are overflowing. I've had people stay in the ER for sometimes weeks earlier on, and there's no beds to put these kids. I mean, it really is an emergency. It's well named by that. All right, let's talk about what do we do about it. Well, the first thing is to understand, going back to anxiety in general for a minute, that these are students. And so when you have someone who has any kind of a neurodiverse issue, ADHD, ASD, learning differences, all of these kinds of things, that automatically puts them at a higher risk. So on any given day, if you have a learning disability, almost are going to have an anxiety disorder. And ADHD, it's about 40% on any given day are going to have an anxiety disorder. Okay, so it's really important that we understand that school can be really, really hard for these kids, and they respond with this urge to avoid doing homework, doing a lot of different things because they are very, very anxious trying to do work because they have low frustration tolerance combined with effective functioning challenges, all of these kinds of things. So if you have someone who learns differently in your class, and you do, obviously, then know that they are at an increased risk of having an anxiety or other emotional disorder as a consequence simply of having that learning difference. Anxiety, let me tell you about anxiety for a minute and the way it impacts the learning process. So if I ask you for your phone number and you give it back to me, you're using your long-term number. If I give you mine and ask for it back a few minutes later, you're using your short-term number. If I ask you for yours backwards, you're using your working memory. Rotating, manipulating knowledge. This is the process of learning. And it's central to being able to display your knowledge. on tests, for instance, or any kind of assessment. And it is the most vulnerable cognitive structure for anxiety. Okay? And so when we are talking about this, it's really important that we know that this is a neurologically based interference process. In addition to the working memory, we know that threat cues are prioritized. And I'll give you a little snapshot about how we deal with anxiety. There's many different kinds of anxiety disorders. There's one really important common thread, well, more than one, but this is kind of the central one. And that is that people overvalue their thoughts. They think their thoughts are more important than they are. They confuse thoughts with evidence. Right? That's a foundational part of working with anxious people, whether there's kids, teens, or adults, is to help them to have a different relationship with their own thoughts and be able to say, in this moment of having a scary thought about whatever it is, it's kind of like seeing behind the scenes footage to your scary movie. Like you're not going to be scared because you're seeing a greater context of what's being done. Now, that training, kids and adults will perceive their own thoughts as threatening. Right? So, like, I have 3 kids. I love them all desperately. I don't know if any of them are still alive. I haven't seen them since this morning. And I am perfectly fine saying that because thoughts are not dangerous. No one's ever had a fatal thought or a lethal idea. And so I'm not thinking, oh, I hope they didn't get in a car accident. Maybe I should be tracking them on find my iPhone app, make sure the car is where it's supposed to be. I'm not going to have it interfering with me because I don't recognize that thought as dangerous. But if you're not trained, you will. And those threat cues are prioritized because, of course they are, because evolution wants us to not forget about the dangers in the environment. And so it produces that interference. We also know, and when I talk to my kids that I work with, and I say, what do you wish that your teachers or your parents or your friends knew about you that you don't think that they know when you have an anxiety disorder? And the most common answer I hear, by far, is how exhausting it is to be me. It's like having a second full-time job. We've all had the experience where we go to a funeral of a loved one, we've done nothing physically deserving, but by the end of the day, we have nothing in the tank. We say that we're drained. That's the way that a lot of my kids experience every day. And then they come home, and then someone says, okay, take a break and start your homework. And they are not able to do that. They don't have the endurance to be able to do that. So it's important that we understand the learning process, not only in the classroom, but obviously in the home environment as well. Treatment really, really works. So high-quality, evidence-based treatment, which involves exposure therapy, which is the gold standard, going on offense against your fear. We look at about 60 to 70% no longer have a diagnosis of discharge, yet in meds it jumps up to 80%. So 4 out of 5 of these kids we don't talk about cure, like ear infection, but we do say it's in the normal range of functioning. They no longer meet criteria for a diagnosis. Powerfully effective interventions that are tragically underutilized and right now underavailable, which is just a nightmare scenario for me. So let's get into some very practical things that you guys can do to build these skills. How do you create this life effect in school? Number 1 is, I believe, very strongly, that for the human experience, that most of our suffering comes in that sometimes very small space between what is and what we think should be. Right? And so if we're feeling anxious and then we think we shouldn't be having that feeling, we're going to compound our suffering. Whereas the Buddhists say, pain times resistance equals suffering. Right? And so being able to take a non-judgmental stance, and instead of asking what's normal, asking ourselves what is. How do we become aware of what we're experiencing? How do we know that we are strong enough to sit with that emotion regardless of what it is? For the younger kids I work with, I'll have them do a little exercise. Well, all of them, if they're really young, I have them draw a picture. If they're a little older, I have them do a short story about the story of a misshapen cloud. And the kids, even the young kids, will get them pretty quickly. Well, what's a misshapen cloud? Like, well, let's say this cloud popped into existence in the sky and looks around itself at other clouds. They all look a little bit different. They're different shapes, different sizes than this one is. And then people get it pretty quickly that, okay, well, the cloud thinks it's misshapen because it's different, But the reality is there's no right way for a cloud to be shaped, so therefore there can't be a wrong way for a cloud to be shaped. Okay, now we're getting somewhere. Non-judgmental stance, good or bad, has nothing to do with it, we're not going to judge it, we're going to observe it. Then I'll say, all right, now I want you to write a short story about a misshapen feeling. And the kids will kind of get, oh, it's the same thing, because there is no right way to feel. You can only feel the way you are currently feeling, and we don't get to choose it. And so we can choose how we respond to it, and we can be curious observers of the experience. We can sit with it and allow that experience to be a part of our life in that moment. And so that's really important. We also want to talk about stress, because stress gets a bad rap. We know that human performance is at its highest point during moderate levels of stress. So if you're not stressed enough, you don't care enough, you don't put much effort into it at all. Now, if you're too stressed, it dramatically impairs your functioning. Unless you are a psychopath, then that line is way shifted to the right, which is bizarre. But sure, in case you're curious. Okay, so there's that stuff. I want to spend some time talking about resilience, because this is a skill. It's not an attribute or characteristic of an individual. And like all skills, it can be taught, it can be learned, it can be practiced, and it can be improved. And so have a growth mindset about this particular skill. In the same way someone learning a flute or how to do a free throw or how to conjugate a verb, this can be taught. So there's a lot of research that supports these 10 things. And by the way, I'll be happy to show the slides, so don't feel like you have to take feverish notes of all 10 of these. But the first one, the more I do this work, the more I come back to this idea of connectedness. And we've known for decades that the perception of social support is the best protective factor we have against anxiety and depression. Think of it like vitamin C for our immune system against mental health disorders. And over the last year and a half, it's actually, I looked it up, the day a lot of us the day that the pandemic began for a lot of us was when Tom Hanks was diagnosed and the NBA shut down. That was, believe it or not, 616 days ago since that happened. Right? Just to put a number, I looked it up today, that's the number of it. And think about all the obstacles to connectedness that have existed for the last 616 days. And so it's no wonder that we've had so much more mental health challenge when the best protective factor that we've had is taken away at the moment of maximal stress in our lives, especially for teens who really crave that social connection because they're biologically designed to. Altruism. We know that doing something gives us the experience of agency over that situation. This is borrowed from natural disaster research. So there's a hurricane coming, giving a kid an age-appropriate preparatory activity, whether it's packing the dog food, packing your own suitcase, whatever it might be. Doing something gives you some experience of agency over what's going on. So having kids write thank you notes to first responders or doctors and nurses and techs and cleaning crews, which are really important right now, those really help kids, in addition to helping the first responders and people who are receiving those kinds of things. Structured routine. Think of this as the bumpers on a bowling alley. They stop you from going too far afield. What this does is it just takes a lot of demands off of our brain. If there's a routine that we follow, we have to do less planning and preparation of potential outcomes. And so having a structured routine just frees up a lot more bandwidth for these kids to use for creative imagination, or sports, or time with friends, or other kinds of things. So structured routine, or I call it 3 C's: connections, continuity, creativity. Continuity, of course, is the structure. Taking breaks. I would love it if kids learned how to take breaks. And by that, I don't mean when you are feeling frustrated, stop and take a break, because that tells you that you can't persist in the presence of that emotion. Is that you set a time. All right, you're feeling frustrated, you're having a hard time with this. We're going to work, we're going to set a timer for 5 more minutes or an age-appropriate level, and then we're going to take a break. So that we are having a planned break. We know that's really important for learning as well as for mental health and other things. But we don't want to take it in response to our current emotions, because that teaches us they're more powerful than we are. Okay? The next one is maybe the most powerful thing that you as educators can do. And that is to cope out loud. It is to model self-care. Tell the students what you are doing, what you're saying no to sometimes. That's a hard thing for adults to do, with opportunities to do something. Tell them what you're doing to rejuvenate yourself, how you are literally actively pursuing balance in your life. All of these things, because that's how kids learn, is by observation. If they are not hearing those things, they're going to assume that those things aren't very important. Or even worse, parents who are like the giving tree, right? You just want to give and give and give and give and give. And then the kids will learn, oh, that's what I should do, is that I should put everyone's needs ahead of my own. So modeling self-care is a really, really important thing to do. The next one here, acceptance of change. It does not imply endorsement or approval. It just means we're not arguing with reality. Darwin, this is a mistreated quote, but it accurately summarizes his work, said that evolution doesn't favor the strongest or even the most intelligent, it favors the most adaptable. So we know adaptability is nature's highest virtue. What's the first step of adapting to something? Is recognizing that you need to, that something has changed. And so being able to accept that we're in a different world right now is necessary in order to solve problems and to cope effectively with this. Having goals. So when I work with kids, which I do all day long, whether it's in a group or individual, we end every session with every kid naming a goal for themselves that's measurable and achievable in the next week. So we know that having goalposts, and those can be small things, like I want to start homework today as the sun, or I want to leave the house 3 times for walks this week, or whatever it might be for them. It's having a measurable goal that they are learning to self-monitor their direction of travel in pursuit of those goals. And those goals are behavioral, they're not emotional. I'm not going to feel a certain way, because those aren't choices. It's I'm going to do a certain thing. The next one's really important. I was talking, as I said, to Fairfax County Special Education PTA last night, and the 504 IEP kinds of kids with different brains. We were talking before about the inequity of how this is affecting people, and the gap has widened between the haves and have-nots academically. Whether it's because they didn't have access to technology to log on for school, which we know is a real thing for a lot of families, or because their brain is not designed to learn through that format, then these kids have developed a negative self-view. They lack the context to understand their struggle. All they see is the struggle, and they begin to think things about themselves like, I can't get better, or I'm not as smart as I thought that I was. The next slide, we're talking about how I approach that with kids. Again, modeling optimism. You know that anxious individuals respond to uncertainty the way that others respond to threat, which means they are perceiving uncertainty itself as threatening, which means they are, first of all, not optimistic, but also they're looking at this with a very biased view. That uncertainty implies danger. When it doesn't, it implies opportunity as much as it does danger. And so it's really important that we see that. Let me go to the last one for a minute. So this is an important one. I believe that human suffering and struggle are pregnant with meaning and purpose. Say it. Our suffering and struggle are pregnant with meaning and purpose. We think back to Viktor Frankl and Man's Search for Meaning. The idea that suffering is so intertwined with our experience that if our goal is to avoid suffering, we are destined to fail immediately. So what can we do? We can find meaning embedded within it. And thankfully, that changes the entire narrative. And so what I'm encouraging teachers to do, or parents to do, or other people who work with kids, is to facilitate self-discovery. Ask questions such as, what have you learned about yourself during this time that you wouldn't have otherwise learned? And I don't know the answer to that question, but I know it's the right question because it's going to orient them towards a growth mindset about what and how they have changed. What's changed, how have they grown, what skills have they gotten, especially related to flexibility and creativity. Because flexibility is anxiety kryptonite, I promise you that. These are the kids who learn differently. So this idiot there on the left drove his Ferrari on the beach and should be barred from ever owning a Ferrari. But that Ferrari has lost none of its horsepower, or its suspension, or its beauty, or its interior. It's simply being asked to do something it was never designed to do. You take that Ferrari and put it on the racetrack and it's going to go, go, go. These kids are those Ferraris. They don't understand that they're on sand. All they see is they're not going forward. And so being able to give them the context to this, asking them questions to help them see this differently. Like, hey, what would win in a race? Like a 4x4 pickup truck or a Lamborghini? Well, it depends entirely on where you're driving. Right? What's faster, a cheetah or a mako shark? Well, depends if you're on water or land. And helping them to see context, because many of these kids lack that context. This is the one I want to end with, and then I'll take questions from you guys. Self-efficacy is the best predictor of mental health. And we have a dictionary definition of an individual's belief and their capacity to execute behavior necessary to produce specific performance attainments. What it really means is how effective you think you can be in accomplishing your goals in the presence of obstacles. Think of it that way. And it also is a skill. And one of the ways we can boost this is by encouraging and facilitating mastery experiences. Mastery does not mean you're the best at it. It just means it's an area of competence where you feel confident in your ability. For my 11-year-old daughter, it's dance. It got her through the pandemic. She didn't get it from me, I promise you that, but she's really good at it. And she knows it. She's super bendy. How that happened? I'm done. And so being able to give kids the experience of having an area, it doesn't matter what it is. It can be video games, which is a source for a lot of adolescents of ego strength, because I'm really good at this thing, whether it's League of Legends or whatever it might be. I had a kid years ago who was like a world-class yo-yo. I didn't even know that was a thing, but that was his mastery experience. He was incredibly good at the young, unbelievably good. Vicarious experiences, again, a reason to cope out loud. Hearing about what you overcome, and not just the diplomas on your wall. They're encouraging actually Ivy League professors to do this in their classes too, is to share what they've had to overcome to get to where they are. It can happen by watching movies or reading books. There is a great movie called Facing Giants, and there is a clip in it. It's going to sound horrible, but it's on YouTube and you can find it. It's called the death crawl scene. I promise no one dies, it's not violent. It's a football practice where a kid does something that he doesn't think he can do because he's blindfolded, so he can't limit himself to where he thought he could go. And he keeps pushing through where he thought he could be. That's the experience. I had the pleasure just a couple weeks ago getting a talk at my alma mater, good counsel, to the student body. And people introduced me to talking about all these degrees and these places I've been. I was kind of laughing, like, if only they did. And I began my talk by saying, well, what they didn't tell you was my first test I took here was in geometry. I got 12% on it, which is a true story. 3 out of 25 in this next class. And so sharing those experiences can be really, really important. The other one, verbal persuasion. I can't tell you, and I know you know this intuitively, how important it is for a kid to hear from someone they trust, like a teacher, saying, I believe that you can do it. I think it's going to be hard, but I think you can do it. That persuasion makes a huge difference. I'll tell you, I was an intern in 2003, and my supervisor, I had no idea what I would do afterwards. And she said, I don't know, I can see you like running a treatment center at some point. I was like, nah. But I left going, huh. You know, and then 1,000 years later, here I am. But this is the way that I want to leave you with self-efficacy. So I want you to imagine there's this bird on a branch, and this bird looks over, and on the branch, near the trunk of the tree is a crack in the branch. Now, is the bird unafraid because it can think of all the reasons why the branch is strong and unlikely to break? Or is the bird unafraid because it knows it can fly? Knowing you can fly is self-efficacy. Knowing you can handle what comes. Knowing that you are going to be okay, not because the bad or hard thing isn't going to happen, but because you can handle bad and hard things. And I'm hoping that's the silver lining, if there's any, in this awful pandemic, is that kids are learning they can handle hard things that require flexibility and creativity. All right, so let me pause there. I would love to entertain questions, comments, or people who are just in a hurry to leave after a long day. Totally get that.
What do you feel right now that schools or people who work with kids in general, what is being overdone in an effort to tackle this, and what is being underdone?
Ooh, I like that question. The tightrope walk is between accommodating a real disorder and enabling avoidance. And so having someone be told that you're anxious, so therefore we're not going to expect you to do this thing, is dangerous and damaging. Okay? For most of these kids. The story gets a little bit more complicated. So the idea is that I want you to think of, of appropriate accommodations for anxiety as a detour of going to the same place. Just the scenic route to get there. If a different location you're going to, you're probably doing it wrong. Now, if someone has comorbid autism spectrum disorder, for instance, then we lean much more towards accommodation and less towards just doing it anyway in that situation. So I think that that's where some people are getting it wrong, is they are saying, oh, this has been so hard, we're going to remove these things because you're experiencing anxiety. And I'll tell you how I answer that question, is that anxiety will fill whatever space you give it. And so I want you to think of a child's anxiety as a dog begging for food. It's separate from the kid. And so when one of my dogs is begging for me at the table, it's kind of annoying, it's uncomfortable, and it might be tempting to say, fine, here's a big piece of my steak, now go away and never beg again. Now the anxiety is not begging for food, right? The anxiety is begging for attention and escape avoidance, right? But the same process unfolds. If we say, oh, you're anxious, so therefore we're going to eliminate and facilitate avoidance of this thing, or we're going to give you a lot of attention to it, then we're feeding the dog and hoping to stop begging for food. So I think that's what we get it wrong. The underdone part of it is a really good question, which is, my dream is to have a curriculum-delivered coping skills module for every kid, so that they have these skills before they know they need them. And so we can interrupt this pipeline to this pathology in adolescence that we're seeing. We can catch these kids early and give them skills and rehearse them, and have teachers reinforce those and talk about what tests don't measure, where there's a whole lot more than what they do measure. Pass out coping card statements with study guides, things like, just because I'm scared doesn't mean I can't do it. Stronger than my fear. I had a girl, this is a very long answer to your question, but I had a girl 2 years before the pandemic. She had missed 2 years of high school. And she was a soft-spoken girl, kind of really tightly, physically wound up. And so I began working with her, and I said, hey, I want you to finish this sentence for me. Fill in the blank. I can be anxious and blank at the same time. And she thought about it for, it seemed like it forever, and she got this steely, resolved look at me. Nothing was wrong. And I looked at her and I said, what do you have? And she looked at me and she said, I can be anxious and strong at the same time. And she was right. And 2 weeks later, she got back in school and she graduated on time. I got a postcard last year with a picture of her. I asked a younger kid, and he said, I can be anxious and brave at the same time. If I could teach students one thing, that would be it. That you can be anxious and brave at the same time. Courage is never what you feel, it's only what you do. I asked an older guy, he's 18, that took for a while, that same sentence, and he said, I can be anxious and any damn thing I want to be at the same time. And that's the message, is persistence in the presence of fear is what we are looking for. We want these kids to deal with anxiety and other emotions like frustration the same way a palm tree deals with the wind. It doesn't fight against it because it has no need to. It knows its flexibility is its strength. It simply outlasts the storm. That's, in a mnemonic, that's what we want the kids to learn, is how to sit with and outlast the emotions they're experiencing and be flexible enough to not think there's only one right way to feel in that moment.
My question is, and maybe the answer was somewhere in all of that, but like when we have a student who is experiencing anxiety that is making it difficult for them to be in your class or to be engaging in what the rest of the class is engaging in. Like, are there any specific things that we can say in that moment, or how can we help redirect students in that situation?
Great question. I have a slide for that. So basically, the best way to change behavior, and anxiety counts as a behavior, is not what you do when they're anxious, but what do you do when they're not. How do you see them coping effectively in your room at a given point? And how do you go up and give them a full piece of paper that says, great job staying focused today? It's called differential reinforcement. It is the most powerful way that we can change behavior, is by finding what we call positive opposite behaviors and catching them coping effectively and layering that on. When a kid is anxious, the temptation is to go over and offer reassurance. We know, and 99% of parents get this wrong, the research out of Yale that shows that is true. Offering reassurance validates the need to ask for it again, strengthens the anxiety over time. So what we do instead is we get a vague color tone of voice, and we say, I can see you're feeling X, Y, or Z. So you name and contain the emotion. That's helpful. You know, that even giving it a name reduces its intensity. And then we say, hey, what can you tell yourself when you feel that way? So we want them to look internally for coping skills, rather than to seek proximity to a caregiver. And the more time they feel anxious arousal, and they look internally for appropriate coping skills, the more those become, we call it classically conditioned or paired together. So eventually, the presence of anxious arousal will become a cue for looking internally for appropriate coping self-statements, like, I can do this even if it's hard. Those kinds of things. And the coping self-sentences are never reasons why you shouldn't be anxious. They're reasons to persevere anyway, through the anxiety. Dive into the wave.
John, thank you so much for coming.